prevention and how important it is.
So our opinion is about prevention.
Exactly.
Well, what I said is, as a CEO of the mental health organization Mondrian, I think it's my duty to advocate for a wider scope of prevention, preventing children and adults from ending up in mental health care. And I want to ask you to pay attention to prevention in the broader context of mental health care. Nobody will be surprised to hear when I say it's better to prevent a depression than to cure it. We all know this saying for a reason, because prevention is better than a cure. We should write the words prevention in mental health care in capital letters. So that means, in my opinion, but maybe it's important to say that I think it's remarkable that mental health care is not being mentioned in the 2018 National Prevention Agreement. I know we are working on it, but up to now it is not mentioned.
Right.
So that means, in my opinion, that we should focus more on comprehensive prevention on a larger scale, early detection and lifestyle support, prevent mental and social damage at a later age by early detection among young people, and enlarge the knowledge about mental health. And I'm sure that this will decrease the future demand of care and will result in a decline of care expenses.
That's a promise.
That's our promise.
yeah, exactly. Yeah, wow. Yeah. And if you look at from your perspective, being a CEO of a mental health organization, what are the challenges of structurally embedding projects such as the social norms approach into your organization or into healthcare?
Yeah, or into society.
And even in society, yes.
Yeah. Well, unfortunately, in the Netherlands, there is really insufficient structural funding. We deal a lot with fragmentation, also in funding. One municipality makes resources available for prevention and the other doesn't. Unfortunately, mental health care institutions like Mondrian depend on ad hoc funding to finance prevention activities. Besides this, there are also hardly any resources available to measure the results of interventions. Well, this is a great pity, of course, mainly because we have to prove in practice that prevention pays off. The health insurance companies, we talk about municipals and we talk about health insurance companies, they hide behind rules and financing domains. In executing the mental health care law, only defined care has to be compensated. But that also means that prevention activities are not simply compensated. It is, after all, not insured care. Conclusion is that the finance system we have in the Netherlands, and maybe also in the other regions, is not built for preventing the target group entering the mental health care.
Yeah. I was struck by maybe this should be a great quote, and also maybe you said, prove in practice prevention pays off. It's almost poetry, but I think that's the power of it, right? That's what we need to prove.
That is what we need to prove, yes.
Yeah, and SNA could be one of those methods to really say, this works.
Yes, absolutely. And I want also to hold organizations responsible for developing more prevention. But certainly also the health insurance companies should be accountable for their social responsibility. Well, let me start with the organizations involved, organizations like Mondrian. Taking social responsibility by care organizations should be a main theme more and more. For example, by investing in research and innovation. Research on methods that are effective and therefore proved to lead to a decrease of the use of substances and gambling addiction, for example. But also invest in innovation. Give room and tools to professionals on the job to convert creative ideas into specific new activities. Efficiency is often translated as financial efficiency in society and in organizations. But how wonderful would it be if financial profit could be replaced by social profit? And not only by expressing it, but also by adjusting the governance systems and supervision only to match up with the social goals. So supervision on relevant social goals outcome, like reducing the number of patients entering the mental health care. Well, That is what it is all about. Our efforts should be about this. Practice proves that these words don't have to be empty. In the field of prevention, there is a lot of healthcare profit to be gained, and not just for the individual. It also makes our society mentally healthier and more resilient as a whole, as society, as a sensible investment of resources with a positive social effect. So prevention works. It can prevent escalation of problems. We're absolutely sure about that. Social relevance. And that is what it all is all about.
Yeah. Well, thank you. Thank you so much. The last question for you is, and I think that's for all of us. So how come that not a lot of resources go to prevention? What is the reason for that?
I think that has to do with the governance systems in the Netherlands. Only insured care is be compensated,
right,
and not prevention activities. But it should be an added value for the insurance companies as well to invest in prevention.
Yeah.